Nursing places us at the bedside of humanity's most fragile moments, where loss, grieving, and death reveal the deepest truths about what it means to care. Loss is a universal experience that affects patients physically, emotionally, socially, and spiritually. Grief, in turn, is the natural response to that loss, unfolding differently for every person based on their values, culture, support systems, and life experiences.
In nursing, loss can appear in many forms, each triggering its own emotional and behavioral responses. The 5 types are: actual loss. This involves something tangible and measurable, such as the death of a loved one or loss of a body part. Perceived loss is felt internally and may not be obvious to others, like loss of confidence or independence. Anticipatory loss occurs when a person begins grieving before the actual loss happens, often seen in terminal illness. Maturational loss occur in normal life transitions, such as aging or children leaving home. Situational loss results from unexpected events like accidents, sudden illness, or life-changing diagnoses. Each type shapes how individuals cope, adapt, and seek support. The grieving process often follows 5 stages, though not always in order and not experienced the same way by everyone. First is denial. This reaction serves as a protective buffer, allowing the mind to absorb the reality of loss slowly. Second is anger. This surfaces as a frustration, blame, or emotional outbursts. Third is bargaining. This reflects a desire to regain control, often expressed through what-if or if-only thoughts. Fourth is depression, that brings deep sadness, withdrawal, or emotional heaviness as the person fully confronts the loss. And finally, acceptance. It is not about being okay with the loss, but about reaching a place of understanding, adjustment, and readiness to move forward.
In this presentation, our group will explore the concepts of loss, grieving, and death through 2 real-world clinical situations. The first is a patient newly diagnosed with HIV, a moment that often brings shock, fear, stigma, and a profound sense of threatened identity. The second is a patient in the advanced stage of AIDS, hospitalized for a severe pulmonary complication. This case reflects not only physical decline, but spiritual distress, and the complex grieving experienced by both patient and family. To understand these cases fully, we will apply lessons previously learned in this course. Using the atomistic approach, we will examine the etiology and pathophysiology of HIV and AIDS. How the virus attacks the immune system, how opportunistic infections develop, and how disease progression contributes to physical and functional loss. But nursing care goes beyond biological mechanisms. Guided by the lessons from this subject NCM103, we will analyze each patient's experience through a holistic lens, considering their emotional responses, cultural beliefs, coping styles, family dynamics, and spiritual needs. This allows us to view and treat the patient as a whole person, beyond mere medical diagnosis.
Finally, we will apply the nursing process because it provides a structured, evidence-based framework for assessing loss, identifying priority nursing diagnoses, planning individualized interventions, implementing compassionate care, and evaluating patient outcomes. The nursing process ensures that our care remains systematic, patient-centered, and responsive to the evolving needs of individuals facing loss, grieving, and end-of-life transitions. Through these 2 cases, our goal is to understand how nurses support patients and families not only in managing illness, but in navigating the emotional and existential challenges that accompany loss and death.
HIV, or human immunodeficiency virus, is the retrovirus that eventually causes AIDS or acquired immunodeficiency syndrome. Over time, HIV infection suppresses the immune response, resulting in a spectrum of diseases leading to AIDS. HIV is transmitted from an infected person via specific bodily fluids, including blood, semen, vaginal fluids, and breast milk. White blood cells or leukocytes defend the body from infection. One group of leukocytes called T lymphocytes or T cells is part of a direct immune response against infected cells and tumor cells. During HIV infection, HIV targets and kills certain cells in the immune system. HIV attacks CD4 T cells, which are a subtype of T cells that signal other leukocytes to attack a specific pathogen. HIV replicates inside the CD4 T cells, which not only kills them but also allows the virus to spread and infect healthy cells. As HIV continues to replicate and destroy more CD4 T cells, the body becomes defenseless, succumbing to infections. When a CD4 count drops below 200, a person is considered to have AIDS. This can take as long as 10 years from the time a person is infected with HIV. This low CD4 count increases susceptibility to opportunistic infection, such as encephalitis and meningitis. Debilitating illnesses, such as pneumocystis jirovecii pneumonia, and tuberculosis. And cancers, such as Kaposi sarcoma. Patients can die from these opportunistic diseases, not from the HIV infection itself. Although there is no cure for HIV infection or AIDS, medication can slow the progression of HIV infection. Antiretroviral medications or ART, such as highly active antiretroviral therapy or HART, combine several anti-HIV medications in a daily regimen. This medication attacks HIV at several points in its life cycle, slowing its replication. The first drug in the cocktail, a fusion inhibitor, blocks HIV from binding to the cell. The second drug, reverse transcriptase inhibitor, blocks it from replicating. And a third drug, a protease inhibitor, prevents HIV from assembling a new virus. Though it is not possible to completely eliminate HIV from the body, HART slows progression and significantly reduces deaths from HIV-related diseases.
In addition to HART, there are other HIV medication drug classes available. Other treatment options for AIDS include specific medications for opportunistic infections. For example, certain antibiotics are used to treat tuberculosis and pneumonia. Blood tests are performed regularly to check CD4 counts and determine the effectiveness of the cocktail and antiviral. The World Health Organization sets the goal of therapy to be a CD4 of at least 500 cells per cubic millimeter.